Hello again. This is Dr. Pam, Doctor in Nurse Practice. We are talking about skin. I'm just going to talk about skin or dermatology and what you expect in exam. I'm just going to give a summary. If you need more videos of this, you can follow my link and come. I have courses you can follow and see if you can subscribe and get more information. So I'm going to talk about the skin. I'm going to talk about impetigo. Anytime you talk about impetigo, you have to remember honey crusted. There is nothing about honey crusted other than impetigo. And what do we treat with them? Mupirocin. So M for mupirocin and M for impetigo. So don't forget that. And it is pruritic, itchy. So don't forget that. What about measles? Measles, you always have to remember the 3 C's, the coplic spots and the 3 C's. What are the 3 C's with measles? They are the congestion, cough, and coryza. Congestion, cough, and coryza. What about the scabies? Scabies. They itchy. They itch a lot. So they usually burrow in the fingers or in the pharyngeus. So they burrow inside. When you hear itch, you have to remember it's scabies, pruritic, and you have to treat the patient. Permethrin cream we give them, but you also have to tell them to wash everything, and in hot water you have to treat the families. So don't forget that. What about scarlet fever? There is nothing about scarlet fever. If they talk about sandpaper rash and with a sore throat, that is scarlet fever. Don't forget that. Then what about tinea? They have so many tinnias. So remember, you have to educate yourself about all the tinnias. But one thing I know about tinnias, you have to treat with them with everything ends with azores. Okay? So tinnias, you treat them with anything that is azores. Okay? Different kind of tinnias. If you want more, you can check on my course. I have all the tinnias. Tinea vascular, tinea caporis, tinea caputis, all those tinnias. So those are all fungal infection, and we treat all fungal infection with metronidazole, all those. So you have to remember that. Okay, what about molluscum contagiosum? Those are the small, like pupils, like they usually they are dome shaped and they have central umbilication with plugs. And one thing you have to go with this is that if you find these ones in children, you have, especially around the perineal area, you have to suspect abuse and you have to investigate more. That's all I can remember about that. What about pityriasis rosea? That is the one that is like Christmas tree. Remember the herald patches? So remember the Christmas tree like? So that is the pityriasis rosacea. So anytime you hear that, you remember that. What about Rocky Mountain spotted fever? Red spot like rashes that appear in the palms and the feet. Palms and the soles of the feet. That is so important. There are only, if I can remember, it is that Rocky Mountain fever and the syphilis. Those are the only things that I remember that talk about having the rashes on the arms and the feet. So remember that the Rocky Mountain fever, we have to treat it with doxycycline. This is the only one that we can give doxy to young children. So that you have to remember that. The Rocky Mountain fever, we have to treat it as soon as possible. But erythema migrans, which has the red target like clear, like central clearing, which is like Lyme disease. Remember that? Lyme disease, erythema migrans. That one for young children below 7 years old, we can treat them with different antibiotics. But anybody who is older than 7 years, we treat them with doxy. So over 7, doxy. Below 7, we can treat them with amoxicillin or all these other antibiotics. Okay? So we've talked about impetigo, measles, scabies, scarlet fever, tinnitus, pityriasis rosacea, molluscum contagiosum, erythema migrans, meningocemia, purple-colored to dark, painful lesions. You have to treat them with rifampin. You know that, guys. So I think with the skin lesions, remember about the basal cell carcinoma, the pearly wax lesions. Remember that? You also have to remember atopic dermatitis. Other diseases associated with atopic dermatitis are asthma and eczema. Remember that. Contact dermatitis is allergy to something. Maybe you have a watch, you are allergic to that. That is contact dermatitis. What about dog bites? Dog bites, we treat them with amoxicillin. So amoxicillin with clivolate, which is augmentin, we treat them like that. What about ectonic keratosis, the precursor for squamous cell carcinoma? What about seborrheic keratosis? It is benign. They look like they are pasted somewhere. So those ones, you don't have to worry about it. One thing you have to worry about before you go for exam is psoriasis. Psoriasis is a red skin, silvery plagues. Nothing is silvery plagues other than psoriasis. Psoriasis, silvery plagues, you know that is psoriasis. But there's also two things you have to remember about psoriasis. The Koebner phenomena is a new psoriatic plague formed over a skin trauma when that psoriasis is touched, and then it forms a trauma that is called Koebner phenomena. And then there is the ospitis sign with a P, pinpoint bleeding. So remember that, pinpoint bleeding with ospitis sign. Because it has P there, remember, pinpoint bleeding. That's it. Remember shingles, guys. I'm only going to do 10 minutes of this. Shingles, infection of trigeminal nerve or herpes zoster. It can affect, if they talk about affecting the nose and all that, refer them out because somebody can get blind. Anytime you hear shingles is affecting this, photophobia, eye pain, blood vision, refer them out immediately. All right, guys, and always remember, acne rosacea, we treat them with Metrogel. Acne rosacea, Metrogel. And also remember, when they talk about the macules, it is flat, not raised on the skin, like a freckle or a flat birthmark. And the papules, they raise, papule raise. So the two things you have to remember, macule is flat, papule is raised. Okay? Skin conditions without inflammation, we treat them with Keflex. So non-purulent, we treat them with Keflex. With purulent, we treat them with BCD, Bactrim, Clenda, and Doxy. Okay, guys? All right. What about let me see something. Let me see something. Guys, if you need more, please go to my website and sign in. I don't ask so much. I just want to make sure that you pass your exam. There is no way you're going to pass this exam without doing this course reviews. I'm sorry. It is what it is. So all the tinea caporis, which is ringworm, we treat it with, as I said, we treat them with azos. Which one is that again? Tinea cruitz, Cruitz, or jock itch. Down there when mostly men is warm and most men are itching down there. We also have tinea barbi, which is for the beard. And then we have tinea pedis, which is athlete's feet. Most of the tinnias, we treat them with ketoconazole, microconazole, some conazole, anything that ends with azoles. So we treat those ones with that. Acanthosis nigricans, remember, for DM patients with diabetes. Acanthosis nigricans. Those are the velvet. You hear in exam somebody saying the velvet skin. Remember that quickly is the patients with diabetes. Even they have not been diagnosed, do the blood work, do A1C check and see what is happening. Cheilitis is the chopped lips. Angular stomatitis, inflammation or cracks in both corners. Okay? And please don't go to the exam without knowing Steven-Johnson syndrome, which is a medical emergency, abrupt slugging of tissues, which can be caused by medication like allopurinol, which is for gout, NSAIDs, or penicillin. When somebody has those allergies, please remember squamous cell carcinoma, the second common cause of cancer. Remember BCC, basal cell carcinoma. I've talked about it again, where it bleeds easily. There is that thing they call let me see if I'm going to remember it, guys. Oh gosh, I have to write it down. There's that thing they call, oh Lord, okay, I forgot it. I remember it. What is that thing? Gosh, what am I forgetting? Can't remember that thing. But anyway, remember the melanoma, the ABCD, asymmetry, irregular, different colors, over 6 millimeter diameter, evolving. That is melanoma. Always remember that. And I think there's something I am forgetting, guys. I think that there's a name that it can't come. I've found it. It's called telangiectasia. Dilated capillaries, especially people who have like a cancer or whatever. On my courses, I have even pictures of it. So if you decide to take my course, you will see I have nice pictures for you guys. If you take my course, it's no way you're gonna fail the exam. I'm sorry, but I have really good pictures for you. Beautiful pictures. So it's a crash course. You do it. I've covered everything. So I think that is all that I've covered with the skin. Folliculitis, blocked hair follicles, small pustules in an hair bearing area. All right, guys, don't forget that. Don't forget. So that's about skin. I just covered what I could. But if you like my videos, you can subscribe. I'm going to share the link. You can subscribe and get all the videos there. I have with pictures for you to pass this NP exam. Thank you. I'm yours faithfully, Dr. Pam Obare, DNP, FNP. Thank you. God bless you. Thank you.